Hello, thank you for allowing me to meet with you today. So, I am Dr. Tanisha, and I have been practicing in the mental health field for the last 23 years. I've been in private practice for the last 16 years, and I've been teaching as an associate professor for the last 18 years. In my practice, I do individual couples, um, and family. And my theoretical orientation of practice is cognitive behavioral therapy, but I also pull from rational emotive behavioral therapy. And when sessions are brief, I will use solution based therapy. Hi, I am Dr. Zaisha, and thank you for giving me the opportunity to meet with you today. I have been practicing in the mental health field now for the last 23 years. I've been in private practice for the last 16 years, and I've been teaching as an associate professor for the last 18 years. In my practice, I do individual, couples, and family. My theoretical orientation of practice is kind of behavioral therapy, but I do pull techniques from rational and behavioral therapy and solution focus when the sessions are brief in moderation. I have worked in inpatient psychiatric hospitals. So I've worked with individuals who have been diagnosed with bipolar, schizophrenia, depression, anxiety, and who have a history of extreme trauma.
Case up. Here's like structure as and like
So I would definitely say that self-care is my soapbox, and I am a huge advocate of self-care. And over the years, I've gotten much better. So the struggle that I probably have is even though I do take time for self-care, I probably could add more in. So I take time off from work when necessary. I have a really good work-life balance. So at a certain amount of time, I just cut it off because I'm married and I don't like to stay married. I travel a lot. And so I did bi-weekly massages. So those are the things I do well. But again, I don't think you can ever have too much self-care. So that's probably my challenge. Like a go-to place or go-to person. So I do see a therapist. I see my own therapist. That's probably number one. So that helps me maintain my own mental health. For me, my go-to is I like to color. So when I can just detach from all electronics, I pull my coloring book out. Um, I probably get a chance to do it maybe every other week, not as often as I like to, but if I can just sit and color, it is my peace of mind.
it's her daughter. Oh, yeah, feel.
My goodness. So, because I have had to learn how to do self-care, it is the most rewarding thing. I actually just got back from a women's retreat about 3 weeks ago in Sedona, Arizona, and it was amazing. We were able to just detach from all computers, even though we had cell phones because where we were in the mountains, we couldn't use cell phones, like we didn't have any service. And so it was intentional but unintentional. So when I am able to engage in self-care, it allows me to recharge. And so when I'm my best, then it allows me to be better able to serve my clients. So taking care of yourself is really my soapbox. Every week, I'm making a post and I talk about these are things you can do for self care. Don't forget to take care of yourself. I know, especially for women, I feel like we walk around with a cape on like Superwoman, and we have to take care of everybody. We're taking care of friends and families and spouses and kids, and we're like the last person to take care of. And so, when we're not taking care of ourselves, then it makes it so much more difficult to take care of others. And I've had to learn that the hard way. So now I really do prioritize myself, even if that means saying no, which I had to learn how to do. Had to write a book to remind myself. But yeah, self care is important for me. Oh man, you're just all in my head today. So I think so in May was mental health awareness month. And so I did 31 tips to help individuals increase their mental health. And one of the tips was I talked about write a gratitude journal. And so I think we can get so busy with life and the things that we want, we often forget the things that we have. And so at the beginning of every year, I do 30 days of gratitude and I list them. And I am an added fan of little stickies. So I write everything that's important on stickies. And so when I do my gratitudes, I write it on stickies and I stick them in front of me just to remind me again. Sometimes I forget until I get sick how important it is to just not be in pain, right? It's like my body is aching, but when I'm not in pain, I take that for granted. So for me, it's important to just remember everything that we're grateful for because it helps us maintain our mental health.
Mhm. Deal. Perhaps if you can help us out to tell us what I found that I could to change the way I speak.
Mm-hmm.
Made a difference where I started there. And tell me about this from people. But for I want you. You the nut that you have there is the cheese about. Yes, it is.
Right. Absolutely. I had to get to that place, especially when I think spending years in a school learning how to be a counselor, you place a lot of emphasis on helping others. And so it's not a program that really focuses on who you are or your assets. And so you spend a lot of time talking about how you can help others. And so when I finished school, which was over 20 years ago, that was just it. I really placed an emphasis on everyone else. And so I'm finally in a place now where I truly do understand my worth and my value. And it shows up in my business. And when I started my practice 16 years ago, it did not. And so I was doing things that were not reflective of my worth as an entrepreneur, as a clinician, as an expert in the field. And so now things that used to bother me, they don't bother me. How I run my business looks very different because I do understand my worth and the value that I bring to the individuals that I work with.
What's
So it Sure. So it's interesting that you asked that question because I still teach. I teach graduate students, and I'm not going to say all, but definitely there are some graduate students who have perfectionist tendencies, and they want to see 100% on everything. And so I just finished interacting with a student who did not get 100% on an assignment. They wanted to know how she could, get extra credit points and she was not receiving the feedback well. And so I just kind of went over and I explained the difference between the goal to do well, but the desire to be perfect. To be perfect. And in this field, perfection doesn't exist. And so for me, I'm very open to receiving feedback, criticism, critique, whatever that individual wants to give me, because I understand that I will always be work in progress. So the tools that I use today, I didn't use them 5 years ago. And so I know 5 years from now, I'm going to be using a different set of skills that will hopefully help me when working with my clients. But I may not get that information unless somebody points it out or somebody identifies that, what, there are other techniques that you can use that can be more beneficial. Or someone can say, what, I noticed that you did this and that's probably not the best technique because the field of counseling is ever evolving, changing so quickly. So sometimes I can be outdated on the things that I'm doing. So I'm very open to feedback. I do value feedback because I've always had mentors and coaches. And so if I'm not willing to listen to someone who's going to guide me, then it doesn't help my professional development or even my personal development. So I'm always looking for feedback. How can I become a better version of myself? You mean how that happens in social media land or just in life in general? Because it happens. So I've definitely learned over the years to not take it personal. That's probably the biggest thing. But also Because of my clinical background, sometimes I see things as projection, and the things that they're saying are not really about me, but it's about them. Sometimes I hear responses that people make, and I see it as a trauma response to something that they've gone through. And so it just depends on what the scenario is. I often don't take it personally. It's those small occasions that I might take it personal because whatever I'm putting out. And I know for me, if I'm saying something, it's uplifting, it's supportive, it's motivational. And so for someone to come back with something that's negative towards me, for the most part, I either believe they misunderstood it or this is a trauma response that they're having. So I don't take it personal. Even in the beginning, if I want to take it personal, like, well, why would they say that? Then I check myself. I'm like, you know what? That's not about me. It really is about them. And so that's kind of how I learned to deal with it. And the more I show up online, I won't say that I get a lot of negativity for the most part. People respond to my content very well, but the few that I get, I think I just kind of respond in kindness because I understand it's just not about me. And even if you don't like me, I'm not everybody's cup of tea.
Understand. Like, so that people.
Absolutely. So if we were talking about receiving feedback or criticism, or trauma response for someone is not being able to receive feedback. And one of the reasons why they are unable to receive it is because they probably had early childhood experiences where they were not given affirmations or positive affirmations. Maybe they weren't supported. Maybe they didn't come from a loving household. They didn't have support at school. And so when they hear things, even though it's to help them, they don't hear it as something that's encouraging. They hear it as something that's a put down because that's been their experience. When people have said things to them growing up, they heard the negative and they didn't hear the positive. So that would probably be an example that comes to mind is when people are unable to receive feedback. That's a trauma response based on their early childhood experience.
Yeah. If prefer. You get inside of type. You'll then support. No, then there's the. It's not. Mm. Yeah. One that freckles. One that is well and then that is so. Yeah, okay. But that is sticky. Communicate, like say, what's wrong with you? Yeah. And saying something that behavior. You don't know what this is.
Right.
So, yeah. That's something. That's what it is. That's why she asked me, well, it's true. Yeah. You're like driving one something.
Yeah.
Was it? Yeah, that's about so it's hanging on something. Yeah.
Hmm.
That's something that
Absolutely. So the two are interesting because currently I teach professional counseling ethics, and it is one of the first classes that students in our graduate program take. And they enter the class with so many misconceptions about what you can and cannot do as a professional counselor, and the difference between one's moral code of ethics and the code of ethics as a professional counselor. And so, even though the two may be different, sometimes our code of ethics align with our moral sense of morality, but they don't always. And so, I talk about the importance of making sure that even though our sense of morality is what guides us, the difference between right and wrong. Our code of ethics is what guides the profession. It's our ability to do no harm, right? But it also protects us as professional counselors. So for me as a professional counselor, it's very important for me to make sure that I'm aligning with my sense of morality. And I connect morality with integrity. And so people who, for me, lack integrity are people who I would say have a questionable sense of morality. And so it really guides my path. Like I'm making the determination between what I think is a good decision or what I think is a bad decision, what could potentially hurt someone or what could help build someone. And so um, for me, that's what my morality or how my morality lies with my sense of professionalism. But I think you talked about being authentic. What's the other one? So, one of the theorists in the field of counseling, his name is Carl Rogers, and he says that in order to be an effective counselor, one has to be genuine, possess empathy, and have unconditional positive regard. And so, as a professional counselor, I align with being authentic, right? It's who I am. I can't show up as anyone different, which is why when I'm online posting content, what people see is what they get. When they come to my live, what you see is what you get, right? Like I don't get off of a live and then go and completely be a different person. I say things that are congruent with how I practice and how I live. And so it's important for me to be authentic because I don't want people to meet an imposter because I don't want to meet imposters of other people, right? And so I give people what I want in return, and that's authenticity, genuineness, and I convey a sense of empathy that's governed by my morality. Oh my goodness. So I think I have always had a helper spirit. I was the kid that was helping everybody, whether it was if I saw a kid on the playground that was by themselves, I was the one who wanted to go over and pull them over so they could play with my friends. And so I remember, and I say this now to people, and they look at me like I'm strange, but do you remember the show Growing Pains? And so the dad on the show, he was a back then they called him a shrink. And so I remember being in elementary school saying, I'm gonna be a shrink when I grow up. I'm gonna talk to people for a living because people tell me all their problems. So I really think that I have always had a helper spirit and it just felt natural for me to fall in line with the field of counseling. And so when I was in college, I went to school. My major was psychology. But I later found that psychology and counseling were different disciplines back then. I did not know that. And so my frame of reference aligned better with that of the professional counselor than that of the psychologist, because I believe that everyday people have everyday problems, regardless if you have a diagnosis or not. And my goal is just to help build people on a wellness continuum because we're not always doing our best. And when you're not doing your best, sometimes you just need a little bit of encouragement to get you back to the other side of well. So that's kind of what
Yeah. Feel like show you that. Let's say, yeah, yeah, Garber. And yeah, talking about this first medicine. That was cute, but issue was very different. And up and that's just because he
absolutely. I think. Oh, sorry. I was gonna say, I think one of the as horrific as COVID was, one of the things that did come out of COVID was people started going to counseling that never went to counseling before. And I think our aim is to continue to decrease the stigma against and around counseling and mental health. And even though we're not where we want to be in the profession, we're definitely where we're further along since COVID. And so there are so many more people that are open to the process and understand that mental health is real. Everyone has a mental health, but mental illness is also real. And if you don't take care of your mental health, it could lead to mental illness. So I think that this podcast is definitely instrumental in helping people understand that they're not alone, that there are people that that can help, and that will not tell you that what you're saying is not true. I do. So a couple years ago, I had been saying I'm going to write a book, I'm going to write a book, but just got too busy and kept putting it to the side. And so finally, I decided, I'm going to write these books. And for about 12 years, I've been helping other therapists start their own private practice. But it was just something that I was doing when I could get around to it because I was seeing clients that I was teaching. And about 3 years ago, I decided that I really wanted to make the transition to helping more therapists. I would right after COVID because I was full. All of the colleagues that I knew were full. We could not find appointments for clients. Everybody was just full to capacity. We had weeks and weeks of waiting lists. And so I knew that mental health was something that was definitely not going to go away, that more people were going to need it. And if individuals were in their own private practices, that they would most likely stay in the field longer. And so I wrote a book, and it's called Private Practice in 30 Days, the things they didn't teach you in school, the business side. And so it literally walks any therapist through a step-by-step process of starting their business. And so after launching the book, I cited so many people who were interested in it. And so I realized, well, I cannot work with these people one-on-one. So then I launched Powerhouse Coaching Academy, which is a coaching business where I help therapists who want to start their own practices. And because I kept getting such traction from people who, well, from therapists, I started getting messages from people who are not therapists, but they wanted to go into the field of coaching. And so I was like, well, at this time, I want to working with therapists, but here's some resources for you. And so that kind of picked up, and I was like, well, maybe I should probably start working with these individuals too, because I keep getting these messages. So now in my coaching business, I help therapists who start private practice, but I also help women who want to launch their own coaching business, but they don't know necessarily how to get started. So those are the two things that I do underneath my coaching business, and that's the book. The other book is called Stop Hearing and Start Listening. And so as therapists, I realize that people think that they're good listeners, but they're really not. They're good hearers. They hear sound, but they don't really listen. And so my couples really struggle with communication, or at least they think it's communication. Um, but it's been my understanding that they don't communicate well because they don't know how to listen to each other. So I wrote a book just to help people improve how they listen, whether they're working in corporate America or they just want to improve their relationships. The book teaches you how to be an effective listener. I also included a listening scale in the back of the book. So when people say, oh, I'm a great listener, go ahead, take the scale in the back of the book and let's see if you are a good listener. So those are the two books that I currently have on Amazon. And then I have some other books that are ebooks. And they just talk about how do you build your skills as an entrepreneur.
Experience like your first because you're
Mm-hmm.
made this so people can actually go, I actually can, watch it and then be able to reach out to you because like you said, so the hardest thing for the age right now was kind of going so I didn't find a therapist.
Mm-hmm.
You couldn't even find a place to go.
Yeah.
I thought this is and I'm shelter and working with me to what yeah, amazing. Did get on it there with the level time, but I the game was so overwhelmed.
Yeah.
Like, threw me excited all the out.
Right.
That's what I'm going to find someone so I used temporary self fear and I was hard to body get.
Mm-hmm.
So, so that's one of my to bring people together at something talk to each other and look at each other. Well, you can develop work, which I see you as individual as individual closer.
Right.
Uh, uh, was a new stock video. Give upload this works right here, and I'll say but it's just together. The HP let's do video or the software.
Anytime. Anytime. Love to come to you too. Okay.